A patient presents with a painful calf mass. An MRI suggests sarcoma. Surgery is scheduled. But a critical step is skipped, and the consequences are permanent. This is Case Closed, the series that examines real malpractice claims to help podiatric professionals protect their patients and their practice. A 54-year-old male presented to the insured with a painful lump in his right calf. The mass had been present for a year and was increasing in size. The insured estimated it at 5 to 8 centimeters. The insured ordered an MRI. The interpreting radiologist measured the mass at 3.3 by 3.5 by 4.3 centimeters, described it as solid and deep in the right calf tissue, and noted, "This is a sarcoma until proven otherwise." The insured recommended surgical removal. Before clearing the patient for surgery, his primary care provider recorded a medical history significant for removal of a schwannoma in 1995. The insured's consent discussion with the patient included the risk of nerve damage and other specifically identified significant risks. During surgery, the insured noted complications stemming from the mass enveloping the tibial nerve. The nerve was severed and could not be reconnected due to retraction of the nerve ends. 6 days post-op, the insured referred the patient to a neurologist for nerve conduction studies. The pathology report came back indicating the mass was not a sarcoma. It was a schwannoma, a benign tumor that forms in and around nerves. The final diagnosis was schwannoma. Completely excised, no malignancy identified. Following surgery, the patient claimed he developed an abnormal gait, nerve damage, and complex regional pain syndrome, or CRPS. The allegations against the insured included unnecessary and improperly performed surgical excision of the mass, failure to appreciate the patient's history of schwannoma, failure to refer to oncology or peripheral nerve surgery, failure to order a fine needle biopsy prior to surgical removal, failure to perform a biopsy or have pathology in the OR prior to removal of the mass, and failure to order a microvascular consult immediately upon severing the nerve to allow for same-day repair. The defense case was weak. The patient's treating neurosurgeon supported the patient's claim that the mass was another schwannoma, but the insured had insisted it was a sarcoma. External experts offered little support for the insured's position. While the insured had documented the informed consent discussion regarding nerve damage, that documentation was not enough to defend the case. The surgery was unnecessary and could have been avoided if a biopsy had been completed prior to surgery. The claim was settled prior to trial. There are 3 key risk management takeaways from this case. A patient's past medical history is critically important to obtain and document. Documenting the patient's history, your thought process for additional testing or referrals, your treatment decisions, your conversations with the patient regarding the plan of care, and the patient's informed consent can reduce both the risk of a poor patient outcome and the risk of a lawsuit. Second, refer to oncology if cancer is suspected, and confirm the diagnosis via biopsy before proceeding to excision of a mass. Biopsy should be considered as soon as there is any clinical suspicion of cancer, or there is no resolution or change in the wound within 3 to 4 months. Obtain a copy of the biopsy report prior to performing an excision or other surgical intervention. Third, immediately consult with a subspecialist if a complication occurs. When a complication arises during surgery, act quickly and get help from a subspecialist if needed. This case is a reminder that thorough documentation, proper referrals, and biopsy confirmation before surgical intervention are not just best practices, they are critical safeguards for both patients and providers. When those steps are skipped, the consequences can be severe and difficult to defend. To learn more about misdiagnosis, unnecessary surgery, and surgical risk management, and to download this case study, visit our website.